Hi, I'm Veronika and I'm a second year Physician Associate student at UEA. So the Physician Associate career isn't that well established here in the UK, but it is in other countries such as the US. And I have a few relatives who live there and they work there as doctors. And they do work alongside physician associates who are physician assistants over there. So they told me about it, recommended it as a career to me, so I looked into different courses in the UK. So we are a dependent practitioner, so we work directly under a doctor, but we are also very autonomous and we do have more patient contact, which is something that I was looking into when I was choosing this as a career. A typical week would include lectures as a course, but also with medical students. We also have sessions on communication skills where we learn to do things like break bad news to patients. And we also have sessions in the clinical skills lab where we learn to take blood, for example, as well as learn to perform examinations on patients. We are a small cohort and we get on really, really well, and we all come from very different backgrounds. For example, we have nurses, physios, and also people who just come straight from university, for example, from biomed backgrounds. But that makes it really good because it means that we can fill in each other's knowledge gaps and it works quite well. It's quite hard to answer because we've learnt so many interesting things on this course, but I have to say the communication skills has been really good, especially as someone like me who hasn't come from a clinical background. To learn how to be able to speak to patients properly before we actually do see them in a very safe environment has been really useful. There have been many moments on this course, especially on placements, when I realised that this is definitely the career for me. For example, in the first week on placement last year, a patient came up to me and has said how just having someone to talk to has made her stay a lot more enjoyable, and that was really nice to hear. Growing up, I always wanted to work in paediatrics, so starting this course I thought that's where I would eventually go into. But actually going on placement and seeing the different areas where we can be involved has made me realise just how versatile this role is. So I can't really safely say where I'd want to eventually end up because it could be anywhere, as I really enjoyed it.